Okay, it's 10:30 and we do have a quorum, so I'm going to call the meeting to order. And maybe we should have introductions. Dave, you want to start?
Sure, I'll start. So Dave Wyndham, Mason County Community Services Director.
Lydia Buhite, Mason County. Who am I? Mason County Community Health Manager.
And we just met Mackenzie, who's the clerk. And we have, go ahead.
Me, Kathy McDowell, City Council seat 2.
Gary Plews, Firefighters Association.
Dan Stein, Health Officer.
Hi, Dan.
And in Nebraska.
Wow. And we
I am
have
driving in the middle of nowhere, Nebraska. But don't worry, I'm using hands-free stuff.
and we have Sharon Trask,
Mason County Commissioner.
and I think I saw, did Kevin come on?
Kevin Schutte, County Commissioner here.
Okay. Can I get a motion to approve or is there anyone else that I missed?
I see Alex.
And
Oh.
Carrie Davidson, Shelton School Board.
Oh, that's right. I saw Carrie earlier. Thank you, Carrie.
Alex Pacey, Environmental Health Manager.
Okay, now did I miss anybody?
Randy Netherland.
Oh, you're on too, Randy. Okay, I didn't see you come on. Okay. Can I get a motion to approve the agenda?
I move we approve the agenda.
Second.
All those in favor?
Aye.
Aye.
Those opposed? I didn't hear any nays. Okay, how about an approval of the minutes?
So moved.
Second.
Any discussion? All those in favor?
Aye.
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 Any opposed? No. Passes unanimously. Okay, so let's have the health officer's report.
Thanks. So obviously the big topic for the past many months is COVID. So I'll start with that. We're continuing to monitor and address the current cases and watching our current spike start to trail off. We've been starting to see that the number of tests that our partners have been running has been slightly reducing, but our case positivity rate has been reducing as well, suggesting that the prevalence in our area is starting to go in the right direction. So we're seeing a lower positive rate, and we're also seeing reduced cases per 100,000 over the past few weeks, and those have been dropping pretty precipitously. And so that's been very positive and has started to give our staff the ability to start addressing some of the other non-COVID topics. And so a couple of the things that we have now been able to start to get back into is starting to restart the focus on establishing our health coalition. So we're hopefully going to be seeing that over the next month or so is recheck in with our community partners. And the other thing that I've been working on is that the Hep C screening and referral to treatment program is about ready to start. We've worked out most of the kinks with the process, and it's almost ready to get going. So that's all very exciting stuff. That's about all I've got to report to you guys today.
Sounds good. Any questions for Dr. Stein?
Gary Plews here. Dr. Stein, about how much more time are you going to be with us?
Well, that depends. We're actively searching for my replacement, and I think Dave can probably have a little bit more of an update on that for you. With my current position, they've agreed to give me until the time that position is filled, or until the end of the year, whichever comes sooner.
Okay, that's all I needed. Thanks.
Okay, so the administration report.
Hey,
Dave?
sure. So got a number of things to roll through here. So you have my my written report where I talked about fire and a number of other things. In that report, I also pulled some data up from the COVID data dashboard. And so just so everybody knows, the data dashboard is part of, there's two separate dashboards on the DOH website. If you Google the COVID data dashboard, that's what comes up, and it looks at epidemiological.
Here's what I found on the web.
Wow, my phone. Epidemiological curves. But the other one that we're watching closely is the data and risk. The risk dashboard. And the risk dashboard gives us all the data points that we're looking at for possible school reopening. So if you were to look at cases per 100,000 per 2 weeks, it's showing us at 66 right now, which is under the 75 threshold to start looking at going back to in-person school. The goal is to get that below 25. So there's a data lag, and our data is showing us at about 33.4 cases per 100,000 per 2 weeks. So it's definitely on a downward trend. I think we'll probably hit there by the end of the first week of October. We'll be below the 25 level. There's two other things that they take into account, and that's how many hospital beds are filled, and they want us to be less than 80%. We are. How many beds are filled with COVID patients? Less than 20%. We are. So we're starting to tick off some of the green boxes, or get some check marks in there that will allow schools to look at reopening, and we're actively engaging the schools with that. We've been looking at the Shelton school system back to school plans, finishing those up. The Shelton School District did a great job over the summer of getting a committee together and working through these plans in very detailed ways. So we're just doing one last screen of it and then hand it back. We've also seen those from the other school districts as well. Next thing is the alternate care facility. It's been essentially ready to go. With the downturn in COVID cases, I still want to look at making sure that our alternate care facility is able to be stood up within 48 hours should we get a spike in COVID, or if we have a spike in measles or other cases, not measles, excuse me, influenza. We have typically in December, influenza B kicks up. It starts to drop off in first part of January, just at the same time that influenza A comes up. So this year we can have influenza A, B, or COVID, or B and COVID, or A and COVID. So we might have some things happening that are different than normal. So we'll have to be looking at that. I just want to make sure that we are staffed up for that. Did talk with Commissioner Schutte and some others about some flu outreach. And DOH is starting a new flu push to get your flu vaccine. And that's going to be a big push for the next 3 months. COVID vaccine, that's kind of a topic that we're meeting on that one every week. And we have a possibility of a COVID vaccine coming out in the first part or to the middle part of November. It's a very specialized vaccine in that it's a ultra cold hold. So Peggy, you probably in on this, it's got to be stored at 80 below. So yeah, there aren't a lot of places that are going to be able to handle the technical requirements.
80 below, right.
At 80 below. But by the same token, we're not going to get a lot of doses. We're thinking for Washington State, maybe 100,000, 200,000 doses for the state in this initial piece. As time goes by, it's going to ramp up. And there are, I think, 4 other soon to be released vaccines after that will ramp up fairly quickly, because those won't have the stringent hold characteristics. Some will have to be held at below 0. Some are a two-part, so they have to be mixed at the point of dispensing. So there's just a number of things coming out. So as we get that information, as soon as we have things nailed down, I'll push that out to the Board of Health so everybody knows. The way the feds are going to run this, and the way the feds are talking about is primarily using pharmacies and hospitals as points of distribution, whereas back in H1N1, we did a lot through local public health. Well, that dynamic has changed, so you'll be seeing a lot of this going out through the large chain pharmacies and the hospitals and the federally qualified health clinics. I talked about the data and risk dashboards. Drought planning is something that we're going to be working on as a group. We'll put that group together, and you wonder, well, what's drought planning got to do with the Board of Health? But it has a lot to do with Group A and Group B wells. And as we get into the water resource inventory area work, one of the things that's come up is what's the drought plan? What's our response for drought? Should we have, big setbacks there? We have a draft plan that was built back in 2015. We're going to dust that off. It was never formalized. We're going to dust that off, update it, probably add some new pieces based on information we've got, and then work that through. Schools, we've touched on. New guidance comes out from the governor all the time, and as Christopher Nelson is up at DM, he's the assistant planner up there at DM working for public health. And he's tracking all those things, so as we get them, we push them out. Public health is part of our responsibility is to order the test kits. So we just ordered another 4,000 test kits for the hospital. We've been ordering test kits for the corrections facilities to be able to do their testing. And that is a big part of administratively what's going on.
Sounds good. Any questions for David?
Hi, this is Carrie. I do have a question for David because I get asked this question by parents, of course, in the school district. You're mentioning the dashboard and the data points that are associated with that. Is there any way to get that published with the daily data of case rates that come out, or is there a better way to publish some of those data points so that parents in our school district can see where we're at in that threshold and what those points are? I've been asked if that information can be put out there in some way.
Yeah, I think we can. There's been a lag. I think the lag is right now up to almost 3 weeks. But I think we could probably do like a Friday update and put it on the website once a week with the most current data, and that might be able to get us where we need to be. So we are talking about that with the PIOs.
That would be great. Thank you.
Okay. Any other questions for David?
I'd also just throw out there that we have a meeting next week with all the school superintendents to discuss our regional plans for reopening schools. This has been a continual meeting that we've been checking in with them, and they've been very involved with the process. It's been a very good partnership.
I do have one other alibi. So as far as the health officer search goes, we got in 4 applications so far. 2 of them weren't qualified to write health officer orders. They weren't MDs. And 2 were from out of state, and they were looking for a full-time position. This is not. So I'm in talks right now with Clark County, who has a deputy health officer that needs 1 more day of work per week. So this might be an opportunity for us to contract directly with Clark County for a public health officer in a way that makes it really simple for all of us. So we are exploring that right now. That might be our easiest alternative. So
Sounds good.
Yeah.
Okay. Go ahead, Gary.
No, I just said yes.
Oh, okay.
I like that idea. That sounds good.
Yep. We wouldn't even have to do an interview then.
no, it'd just be a contractual arrangement with Clark County, which adding a 0.2. I mean, I think we can make it happen. So I'll finish with getting with Alan Melnick, their health officer and director, and we'll see what we can come up with.
Sounds great.
Yeah.
Okay. So Alex, are you still online?
Yes, I am. Good morning, everybody.
Morning.
So would you
So-
like to give a report?
Yes, so I got my environmental health report there for you all. I thought I'd give you guys some permitting numbers because our permits have just kind of gone crazy this summer, and that's been a big part of what staff has been busy with. So other than that, I have some additional stuff for the on-site sewage committee. Do you want me to handle that now, Peggy, or?
Sure, I think it's a good time.
Okay. So we had our opening for the installer position. They got briefed last July. We had multiple applicants to that position. Board of Health put together a interview committee, and we followed through with interviews in August. And then we have a recommendation there for you all. And that's for Thad Bamford for another 3 years.
Okay, and so I guess we have to make a motion for that.
Yes, I believe so.
So do I have a motion to approve that?
Madam Chair, this is Kevin. So moved.
Second.
Okay, any discussion? All those in favor?
Aye.
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 Any opposed? No, okay, so he is approved. So I'll let you continue,
Great.
Alex.
Okay, so next we've got Rhonda Thompson, who is actually county staff. And I know it's a little unusual to have an advisory committee with a county position, but that's how this one is set up. So I'm pushing Rhonda into this position. I've kind of cycled through all my on-site staff the past year since Wendy Jonas had left, and Rhonda's stepped up to the plate to help me with this. So if we could get some discussion or voting on that, I'd appreciate it.
Any discussion?
Madam Chair, move to approve.
Second it.
Okay, I have a motion and a second. Do I have any discussion? All those approved?
Aye.
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 Okay. Any opposed? Okay, passes. Thank you. And I think you have other stuff on your report there, Alex?
Yeah, the last one, I don't see any actual formal action needed, but I just wanted to loop Board of Health in, and I'm glad all three commissioners are here as well. So, you know, as I've gone through this committee and worked on filling these vacancies with Board of Health, you know, this last one, the installer position, you know, we ended up with multiple applicants, and I kind of took a step back and looked at why, you know, all these positions and applications are going through Board of Health. Because really the boards and commissions handbook kind of point everybody to the commissioners to deal with these. So to me, I think this is just a simple administrative change that allows us to process applications quicker by going through the commissioners. I don't see any code change or issue that would be with it. It's really just within their bylaws. I spoke to the committee in August, and they were pretty supportive of it. So just kind of wanted to brief Board of Health on it and the commissioners and see if there was any discussion or thoughts that I may be missing.
Well, when you have a vacancy and it takes us 2 months to appoint somebody, it's, I don't think that's really good, but I don't know. What's the other people's opinion?
Well, having attended the last ones, this is Sharon. So it just makes sense that maybe we can get things moving quicker to get people on the board a little bit easier and faster if we do this small change.
That's what I'm thinking. Anybody else have an opinion?
Remember, it used to be one and the same anyway. That's why it was probably
Yeah.
that way.
Right. Okay, so Alex, I guess you can, I don't know that we really have to vote on it.
No, I don't think so. I just wanted to know if anybody had any concerns or could bring up something that I'm maybe missing. So it sounds like there's support for it. So I'll continue moving forward with their bylaw changes and I guess I'll let the commissioners know next vacancy we get. So
Okay, sounds good. Any
Thank you.
other thing with your report, Alex?
no, I think that's it. Does anybody have any questions for me?
Okay. So let's go to the community health report.
Good morning, everyone. Can you hear me okay?
Perfect.
I got on the phone this time since last time I went in and out because my little Surface Pro doesn't connect directly to the lines. So hopefully you got, I know that Mackenzie sent out my report a little late. Sorry about that. Thought I had clicked send and hadn't. So hopefully you were able to review that a little bit. Highlights right now, I want to talk behavioral health. The LEAD program, the Law Enforcement Assisted Diversion program, has started. And Olympic Health and Recovery Services is our main contracted agency working on that with our law enforcement agencies in the community. And we got it up and running in a couple of months, and we're excited about it. It's a short run. I think it goes through next summer, but then we're anticipating maybe it'll get some more funding to move forward. But by then we're supposed to be sustainable anyway. So we'll have more on the next report on kind of details with numbers and how it's working out. So excited about that. The other one is we got our HRSA grant of $1 million received. We started September 1. That is the grant that we're putting peers, those with lived experience in substance abuse, into a number of agencies around the community. Our partners in that grant that are receiving funding from that include Mason Health, Mason General Hospital and Mason Health, and Peninsula Community Health Services in the North End, as well as in the North End, the Regional Fire Authority, and then Public Health here. And so we're excited about that. We just had our orientation this week with the partners and HRSA. And so hopefully we'll be up and running like second week of October with that. So very excited. And I just wanted to say I'm really pleased with our behavioral health group, which includes the substance use and mental health, where we've literally facilitated or received over $3 million into the county in the last 3 years to do this work. So we're real excited about it. And we're also very focused on sustainability of this work, because we know grants won't go on forever. But we're working on that as well, of having it be sustainable positions that can receive funding through Medicaid and other resources with our community partners. So the community partners have been absolutely amazing in this work. Very excited. So, and then to add to that, the housing piece, in the last 8 months, because of COVID, we've literally had over $2 million brought into this county to be utilized for different types of housing things. And I think the housing group, both our staff as well as our partners in the community, have worked hard at trying to figure out ways to make some of that work become sustainable for our housing needs in the community. But that has required a lot of contracting, a lot of quick turnaround. Basically, the feds give you money through the state and you have like 2 weeks to turn it around and try to move it out. And that's a little difficult, has been a little difficult based on, you know, what our housing availability is to put people into places. But the most recent is stuff to help people that have been without jobs, et cetera, and giving them the opportunity to get their mortgages paid and their rent paid and things. So real excited about that work that's going on as well. Dave mentioned the Hep C, or Dan mentioned, I can't remember now. I think it might've been Dan, mentioned the Hep C work. So we'll be starting that. The money has come in from the state and we'll be starting, well, we've been working on that. Both Christina and Dave have been working on that for the past 4 to 5 months. Dan have been working on the past 4 to 5 months, but we'll actually be looking at hiring a position with the money to continue that work. And so we're real excited about that and looking to work on that in October. Right now, we've got a lot of grant reports due in September. And of course, since COVID is giving us a little bit of a break, the summer was quite intense. I think on my report, if you saw that last page, it was a little shocking when I worked on that graph, or actually I think that graph was created by someone else, but I added things into it. Maybe Dave did that one. I can't remember if Alex or Dave did it, but if you saw that August 28th, 63 that week, that was an intensively crazy week for staff. So it's dropping back off, which has been really nice, and letting staff to actually get to some of their other work, those COVID staff that had been working. We did hire 2 temporary remote employees that have been doing case investigation, which has been a lifesaver, and it's been wonderful to work with them because they love working on the weekends and evenings, which really helps us out. And then we also joined the state's, it's called CREST, which is their Microsoft platform that they created to help manage case investigation and contact investigation. And so that has helped us. It was a little bit of a thing to, in the middle of July and August, to actually sign on to a new program that everybody has to learn was an additional problem, but that was when it became available. So I really commend staff. They've done a great job of that, and that's helping us track things a little bit better and actually helping make less work for the staff. So my staff is returning to their other 20 programs, the rest of my staff and some of environmental health who've stepped up to offer help to us during this time, and that's been nice. And I think that's it. Any questions? Oh, I did have one more thing. Just a reminder, just some things about COVID. So we were for a while having trouble reaching contacts of positive cases. That no longer is the case. Things literally change day by day. So just to bring everybody to update on that, we're having a good success in reaching contacts now. In our long-term care, we have one of our long-term cares that is having to test weekly because the state has certain rules around when you have some cases in long-term care, then they have to go to testing all staff and all residents weekly. So unfortunately, one of ours has had to do that, and they have really stepped up to the plate. That's Furlang, and are working very diligently and very hard with the state and with us to get that all done, and they're doing a good job trying to keep the numbers down, and they are keeping the numbers down. It comes in often through staff, unfortunately, and many staff work in more than one long-term care. So that adds to the problem of transmitting. A lot came from long-term cares in Olympia, and that's how we ended up getting it here. Recently, a statement was made by the CDC that the 6-foot distancing isn't long enough, and they retracted that yesterday. So if you heard that people have to stay further than 6 feet away, that has been retracted by the CDC. And my last thing is just with the schools, we're working, and Carrie, I'll work with you on this too. We're trying to work with each school so we have one contact. What we're requesting is we do not want parents calling this office asking 1,000 questions. We don't have the staffing to do that, but we want to train people at each school or district, depending on the size, to answer those questions, and we will then be in contact daily with that person in case there's needs that need to be dealt with. So that's the way we can handle making it smooth, because what happens is a lot of times, as we found in the past, not just with COVID, but with any communicable disease, rumors get out there very rapidly and they're very inaccurate 99% of the time. So we're trying to squelch that by having parents, teachers go to the school themselves and have a contact there, so that then they can talk directly to us and we can work with them. And also educating the schools as much as possible and the parents that if somebody really is positive, we're very aware of it. And we follow up with that, and we're meeting with all their or talking to all their contacts. I forgot to look at the numbers of the cases this morning where we're at. 380 something, I believe. Quadruple that.
We just passed 400.
Go ahead. Say that again.
I think as of yesterday, we passed 400.
Okay, so we hit for 400. Okay. That's odd. Okay, I'll have to look at that, figure out what happened. So, and there was a jump in cases this Monday, and there was some questions about that. Sometimes we have very large families, and sometimes the whole family can get it. And so we were very aware of numbers coming in Monday that would be a little higher because we sent a bunch of people for testing at the end of last week. So anyway, all in all, it's going well.
Okay. Any questions for Lydia?
Yeah, Lydia, what is the turnaround time on tests now? Is it shorter than what it was?
It goes up and down, but yes, it is shorter. Right now, we're getting usually 24 hours to 2 days. So it's pretty rapid. Depends on where people go. We're not recommending people go running out leaving the county to go get a rapid test of an antigen test. It's just, Mason General has done a great job, and they're monitoring how many tests they need, making sure they have the supply. They've not been doing weekends for a while, so there's always the lag over the weekend. But yeah, we're getting them back pretty quick. The state worked on a lot of different areas and with a lot of different labs, and it's definitely not the problem it was a while ago. It really, when that peak happened across the whole state, same thing we had. And so, of course, the labs got very overwhelmed in the summer, and we were up to 7 to 9 days to hearing on some things. But whenever it's an essential worker, law enforcement, fire, hospital, home care, we can get them in and out within 24 hours usually to 48 hours at the max. And we monitor those. So we always tell those entities to call us directly when they have someone that needs a rapid testing so that we can get it back quickly.
What about for travelers?
Travelers.
Yeah.
You have
to have,
speaking about the requirement where they have to get tested before they can travel, so many days before they travel? We make recommendations to people. They usually go to Olympia to get that testing because they're doing special testing for travelers. We're focusing more on people that are ill or have been exposed in need of it. So we're not really focusing on the travelers as much. There are 3 or 4 clinics in Olympia that are doing travelers, and they do a special deal because it's not covered the same way by insurance, et cetera.
So people have to get a COVID test before they have a procedure also. So is that more at the hospital, or do they have to go? Because they have to have it within a certain amount of time.
Yeah, and literally most of the hospitals that they're going to are giving them direct guidance on where to go to get that in the timely fashion that they need it. It's not something we're handling. The hospitals and the doctors that are having people do surgeries. Dave, you had surgery and you had to do that, I think.
Actually, what we're finding is a lot of the hospitals are going to time rather than testing. So what they're saying is, rather than having a test, which is good for that moment of that day, what they're having people do is quarantine 14 days in advance and then come in for their procedure.
Okay. Not always practical.
No.
Okay, any other questions for Lydia? Okay, we're down to the other business and board discussion. I would like to remind everybody that our next meeting is actually 11/17 due to Thanksgiving. And I, for one, would prefer that it was at 3 p.m. because that's what we voted on and that works better for my schedule, but I would like other people's opinion.
I have no preference. I'm fine with the 3 o'clock time. It's far enough out for me, and I'm here for our other meetings that day anyway. So I'm good with that if it's workable for the rest of the group.
I think it's hard for the public when we voted on a time. I know that we haven't had much contribution due to COVID, but I still think that it would be better that we kept at a certain time.
I agree.
We do have a Mason Transit meeting at 4 that day. So
Okay.
we just have to make it a quick meeting.
We can do that.
I'm good.
Okay, any other board discussion? Okay, so we have COVID presentation?
Yep. So and that's me, and we did this rehearsal, so let's see if it works here. So I'm gonna share my screen.
Okay. I'm glad it's you and not me.
Okay, can you see the COVID presentation?
Yes.
Yeah.
Okay, so you should have a slide show up, okay? All right, now you should be seeing a flow chart. Is that good?
Dave, can you make it your full screen so we don't see everything else?
Yeah, I'm working on it here.
So we don't see the people?
How's that?
There you go.
Okay, all right, so back in March, we stood up the area command. So everything originated with public health, then went to area command. So this is kind of a recap of what area command and public health are doing kind of together and in conjunction with each other. This is the table of organization for area command. So you see at the top, you've got Mason County Commissioners, and then it goes to area commander. And we've been rotating that between Ross McDowell and Ryan Sperling. And then as you see, it kind of branches off into the typical 5 aspects of area command. But then below that, you've got logistics, planning, finance, medical ops, recovery ops, economic ops, and liaison. So initially we were meeting 6 days a week. We're now meeting just 3 days a week. And a lot of these things have kind of tapered off, or they've become steady states of business. So for example, Paige and Jennifer are just continuing to track all the expenses. It's a steady state thing. Recovery ops is where we're spending a lot of our time now in looking at schools, social services, mental health, food banks, transportation. Those are kind of consuming where we're at now. We're not as much in the initial response phases. We're kind of in a steady state and then looking at recovery. Economic operations, we're working with the EDC to handle those. Logistics, again, is through DEM. Christopher and I are working in planning, and Christopher is the one who put this presentation together. So this gives you an idea of it's a fairly complex bunch, and this is, I have to say, this has been I've had emergency operations before. This has been the best area command that I've worked with. It's been just much easier than others in the past. Okay, moving along. So initially we set up our mission to protect ourselves and citizens, contain the spread, secure resources, ensure rapid response. Number 5, keep the public informed, also became keep the public informed and unified, and then move the county to recovery. So we look at this, at each EOC to say, are we meeting these mission parameters in what we're doing? And then using this as our focus, and it's worked pretty well. So safety, obviously, it's something for us up there and really for everybody. So our safety messages come out of up there: personal protective and hygiene, distancing, cleaning protocols. So nothing new there. A lot of this is coming from the state and to area command and out from there. So Lydia put together a comprehensive timeline. There's a lot of stuff here. I will send these slides out to the board so you'll be able to have this. But as you see, we instituted Instant Command on the 28th of February. And I think we're now on day 212. So this has been a lot for us over the past 7 months. And then as Lydia was saying, you get into July and into August, 107 cases over a 2-week time period. We're now actually starting to see that taper off. So we had an initial bump in April, calmed down through June and into July, and then bumped up again late July.
We get a lot of questions from people about COVID-19.
Short video.
Like, what should I do if I get exposed? How long should I stay home? To answer those questions, let's look at a few examples. This is Sam. Sam was exposed to COVID-19 on April 2nd when he saw his great aunt Marion. Since we know it takes between 2 to 14 days for someone who is exposed to begin to show new symptoms, Sam should stay home and watch for symptoms for at least 14 days. Common symptoms are cough, difficulty breathing, fever, chills, muscle pain, sore throat, and loss of taste or smell. Some people may also experience nausea, vomiting, or diarrhea. On April 16th, 14 days after exposure, Sam still showed no symptoms. This means he can now return to normal activities. Now let's look at another example. Sandra was exposed to COVID-19 on April 3rd. When she found out, she stayed home and watched her symptoms. 7 days later, on April 10th, she started coughing. 2 days later, April 12th, she had a fever. People with COVID-19 who have isolated at home can leave under the following conditions. No fever for at least 72 hours. That's 3 full days of no fever without the use of medicine that reduces fevers. And their other symptoms have improved. For example, when their cough or shortness of breath have improved, and at least 10 days have passed since their symptoms first appeared. To figure out when Sandra can leave isolation, we have to look at when her symptoms went away. Her fever went away on April 18th. 3 days later is April 21st. Her cough and other symptoms went away on April 20th. 10 days after her symptoms started is also April 20th. Of these 3 dates, Sandra has to wait until the latest date to leave isolation. The latest date is April 21st. That's when she can return to normal activities. For more information, visit the Department of Health website at doh.wa.gov/coronavirus.
Okay, moving along. So logistics, this gives you just an idea of what we've had, what's come through. We've had a ton of gloves come in, masks, surgical masks, cloth masks. And initially we ran through our stockpile of materials that we had on hand ready for an event. So those materials were used and now we've refreshed those. In the cloth masks, we received 92,000. I think we are at 75,000 or so that have been distributed. We're hanging on to, so those are a push out to the community. We're hanging on to the rest for pull. So as organizations need some, they'll call, ask for it. We'll send it out to them. Okay. So we've got a number of sources. We have had private donations. You know, early on, several dentists gave us a lot of PPE, and that got us through the initial part of the pandemic with great relief to us. It was greatly appreciated. National stockpile, like I said, we rotated our stockpile, and then the state supply. And as yet, we're still not having to pay for those things we're ordering from the state, which is, it's been a lifesaver for us. So, and this one just gives you an idea of the volume of things that we've gone through. So face shields and gloves and gowns. And we order gowns, we order all this material, and we can't specify exactly what we're going to get. So sometimes we get surgical gowns, sometimes we get these very paper thin gowns. So we get what they send us and then we do the best we can with it. Planning, and there's just so many things going to planning. This is a very busy slide. It's just to give you an idea that things are very busy. Guidelines. Guidelines seem to change all the time. We just got the latest guidelines on funerals and weddings. So as things change and new research comes in, DOH puts out through the governor's office guidelines and orders. So we've seen state health officer orders, we've seen Secretary of Health orders, we've seen governor's orders. So at DEM, we track all those and then try to get that information out as soon as we can, either in the daily sit reps or in the weekly reports through PIOs. But we try to get those out, I mean, as instantly as we can when they come out, because many of them have immediate effect. Okay, well, operations. One of the things we found out right off the bat is Mason County is multilingual. So we had some gaps in where we were at with languages, especially. We have Spanish speakers. We have a couple of dialects of Guatemalan that we've had to address in our planning pieces. And in really in all aspects, planning and recovery and ops, economic recovery. So there's any number of those things that go into the operations piece. And public health has had all these great contacts for years and years through Lydia and her group that have these contacts in the community that we've been able to tap. Commissioners have had folks that we've been able to tap. And the county really came together with a lot of resources to make operations actually happen. So we early on decided that we couldn't depend on the state or any other entity to help us. Mason County would help itself, and we've done a pretty good job with it. Medical ops, this is, you think of Dr. Stein, Dr. Gushy at the hospital. This is a big part of their piece. Dr. Gushy is from Mason Health and advises us on our weekly EOC, actually 3 times a week EOC calls. Long-term recovery ops, Dr. States is working a lot of that. He's a volunteer that works with us. Again, you've got mental health and economic health, recovery task forces. Schools are part of that. How do we get kids back into school? What do the plans look like? What are the requirements? And how do we coordinate those efforts? Shelton School District had a committee together that public health sat on all summer, and we worked on putting the plans together. The superintendents worked with Dr. Stein and a higher level aspect of that same kind of work, and came up with great guidelines and plans for the schools, which went out to DEM and to public health for a review. So long-term recovery is where we're at now, and that will continue until this thing is over. Social Services Task Force, another part of that as well. And they're doing weekly meetings, a lot of telehealth. They're looking at some of the mental health aspects, as Lydia talked about. As we get into this and we have the social isolation happening and we have the physical isolation happening, depression, anxiety, mental health issues are climbing, domestic abuse has climbed, Sheriff's Office, City of Shelton PD are all reporting higher rates of those. So we're working on those pieces, working on education out to the community. Big piece of what's going on there, really a big piece of what public health is doing as well. And then again, right now, kind of things we're big topic, how do we reopen the schools? So right now they're on remote learning, except for the 2 private schools, which are doing in-person teaching. And we will watch those schools to see how that works out and kind of use them as our test case. It's nice that they're small and they can nimbly and quickly move if things happen. So where a bigger school system it's a little harder to steer that boat around the corner. So economic task force, again, that's through the EDC, and they've been working on the stimulus package stuff and getting people out there, getting grants and that work. They've helped people with unemployment claims. Just a lot of work that's going on out there to get the money that's come to the county and that's come to the state out into the community. Finance section, that's Paige and her group over there. So you look at this, Mason County, and this is $1,756,000. Essentially, most of that is staff time. So that's a lot of staff hours, and public health is $159,000 just with the public health folks. So this has had an economic impact on public health in that while we are working on COVID-related work and we're getting paid for it, we're not getting paid in our other programs, which we have deliverables in. So it's kind of a double hit. Yeah, we're getting paid, but we're not getting paid for the normal work. So Paige and Casey are working on keeping that financial piece on track. And that's the last slide, just to give you an idea of some of the partners we have. So we have the tribes and PUDs and all the fire districts. This has really been a cooperative effort across the county. And even into the feds, we've had a lot of conversations with the Forest Service, Park Service, corrections. This has really been a group effort. We've had a great teamwork process through this whole thing. It's really, this is a community that is pretty tightly glued, and I'm very pleased with how this has gone so far. And with that, I'll take questions and we'll see if I can get out of this.
Dave?
Yeah.
I have a question.
Sure.
I am not a medical person, so I can't give an answer clearly on this to when people ask it, but how did you come up with a 14-day quarantine time?
Okay,
Why not 13? Why not 15?
that comes from the CDC.
And how did they come up with that number?
So what they're looking at, it was typically symptoms appear from 5 to 10 days after exposure, and they've added the 4 days past that, so that came up with 14 days.
Very good. Thank you.
Any other questions for Dave? Okay, do I have any public today? I don't know if anybody phoned in. Mackenzie?
Yeah.
Okay. So do I have a motion to adjourn?
So moved.
I'll second.
Okay, all those in favor?
Aye.
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 So adjourned.